there are two critical contributions that Southeast Michigan Beacon has made during this past year. One is the continued advancement of care for chronic conditions, particularly in the arena of diabetes. And secondly is the beginnings of a health information exchange for people in underserved areas as well.
We've seen several really large accomplishments here at the Southeast Michigan Beacon community. I think first and foremost, working together across a variety of large stakeholder organizations. And it's really been a very large community-based effort in moving forward all of the aspects of the Southeast Michigan Beacon community.
I'm very happy to say that we've been able to bring these diverse stakeholders together with a single voice to achieve a single goal for the benefit of a broad community.
Well, I think with any community-wide initiative, there will be challenges around the readiness of all of the community stakeholders at any given point in time to take on specific initiatives. And I think that Beacon has been effective at meeting stakeholder organizations where they are along that spectrum to bring them on board in the capacity that they're willing to participate.
How do you connect entity A and B together in an efficient way that doesn't get in the way of what they're already doing and doesn't add additional costs to what they're already doing and doesn't impede their agendas and how they're trying to move forward to improve technology in their own organization. So at Beacon, we have worked tirelessly on that particular challenge.
How do we keep the clinical transformation going? How do we make sure those results stick? How do we make health information exchange within the Beacon service area stick as well? We are working on that at the Beacon Executive Board level, and I expect that to be a dominant concern of the board as we go forward. I think we're making great progress in clinical transformation. There is an 85% satisfaction rate that people are reporting who have been surveyed and have been involved in Beacon's transformative clinical care programs.
We in Beacon have been instrumental in helping physicians in the adoption, use, and exchange of healthcare information. So we've been a big part of that progress. We have brought a lot of awareness and education to our community with respect to the need to do this and the urgency to do this. Because without this, we're not going to move the healthcare needle in any meaningful way.
We've seen a lot of progress in the year 2012 across a number of the Beacon domains, as we call them. First and foremost, we've set forward an aggressive health information exchange and technology supporting agenda for the community, not to replace any individual organization's information technology infrastructure, but to leverage the existing infrastructure in the community toward the exchange of information to help with improvements in the quality of care delivered, to help with cost efficiencies, and to help manage the population for health improvement.
I believe this battle will be won or lost at the physician office level. And I think that we have done a very good job at bringing our physician community on board. Physicians want this. I think everyone knows that we have to move forward with an electronic-based health record and the meaningful use of that kind of technology. So the question really becomes, will it achieve the necessary goals that we want for the future? I believe definitely so.
After 2012, I see emerging in Beacon a business model that all of the actors on the stage in healthcare serving the people in the Beacon area can buy into and participate in. And that would include insurance carriers, that would include healthcare providers, both hospitals and doctors, and other people who are involved in the care of Beacon's patients and individuals.
As we see health reform coming down the pipeline and the necessary tools that will need to be in place in order to better manage the health of a population, improve the quality of care that's being provided to a population, while achieving some cost savings and efficiencies along the way, Beacon is really at the epicenter of all of that reform that's coming down the pipeline. So we have a tremendous opportunity as a community to work together not just to achieve our Beacon objectives in the short term, but to lay a foundation that can help the community for years to come.